Alright, so in this video we are going to learn how to do a free gingival graft. Out of these free gingival graft, we're going to be able to deepithelialize the most superficial aspect, which is the epithelium, and turn it into a connective tissue graft. So I'm going to grab the area that I showed you in the masterclass, which is basically I'm going to take about 15 millimeters of connective tissue graft. This palatal area is the most predictable one in terms of visibility, access, surgical access. And basically, I'm going to start with my horizontal line, about 3-4 millimeters from gingival margin level. As you can see, I'm starting on the distal of the molar because it's enough. And my depth is going to be about 1 millimeter, no more than that. I'm going to start with the horizontal line, mesial and distal line, and at this point you can either do a very superficial apical incision, or you can avoid that apical incision to avoid bleeding until the end. Once you already have the epithelium, which it covers about 0.3 millimeters, you're going to go a little bit beyond that epithelium, so you're going to go a little bit deeper. And if you see that still keeps bleeding, you're going to use a little bit of anesthesia with a little bit of adrenaline, which are with the cardiac patients using adrenaline, but you're going to use anesthesia to block a little bit those blood vessels and have a better access in terms of visibility and less bleeding. At this point, you're going to turn the blade 45 degrees, about 30-45 degrees, and then you're going to start doing a split thickness flap, assuming the fact that you're going to need to go deeper than the epithelium, lamina propria, and submucosa. So you're going to reach basically the deepest aspect without touching the bone. Have in mind that today we're not reaching the bone, we're not scratching that area, we're just leaving connective tissue in touch with the periosteum, so we cover that area, we allow the healing to be faster, and at the same time, we minimize the inflammation and complications for the patient. So basically what I'm doing at this point, I'm just displacing very carefully that free gingival graft that I'm assuming I'm starting to detach from the most coronal aspect towards the apical aspect, and I'm leaving in place on the donor side, I'm leaving a piece of connective tissue. All right, so you don't want to go full thickness, you're going to go split thickness. Once I already know that is fully detached, what I'm doing, I'm finishing with my last incision, which is going to be at the most apical aspect. Have in mind that you don't want to go too apical, you don't want to block those blood vessels, and at some point that free gingival graft is going to come. As you can see, right now what we have is a piece of epithelium, connective tissue, and fatty tissue. That fatty tissue is going to interfere with the attachment of the graft. So in this case, if you want to turn this free gingival graft, and have in mind that the free gingival graft is the one that actually you leave the epithelium, which is going to be exposed, okay? And you're going to face that connective tissue that right now is almost partially covered by fatty tissue that you're going to remove. You're going to expose it to the recipient side. Okay, so that fatty tissue that you can see that I'm basically scratching with a dental probe is the one that you want to remove. Why? Because that fatty tissue is basically interfering with the attachment and new integration of your soft tissue to the recipient side. So you basically, with one plier, you just grab it, keep it in place, and then parallel to the table, to the surface, you keep using the blade until you scratch away all the fatty tissue that remains.